Violence is not part of the job for nurses.
The patient just struck out and began punching and kicking, hit me on the jaw from behind.
Healthcare workers as a whole receive the highest number of WorkSafe injury claims for violence-related injuries across this province.
The Ministry of Health and the BC Nurses Union are joining together to provide $2 million towards violence prevention improvements, starting with 4 priority sites. Those 4 sites are the Forensic Psychiatric Hospital in Coquitlam, the Hillside Centre in Kamloops, Seven Oaks Tertiary Mental Health in Victoria, and the Abbotsford Regional Hospital.
The threat of violence is present in virtually every care setting, including in residential care. So while we're pleased to begin reducing the risks at these 4 sites, we're resolved to see the issue of violence addressed across the entire healthcare system. We are indeed optimistic that the solutions we're about to implement will yield important insights into how we can minimize risks for nurses across the province of BC. Ultimately, it was the nurses who decided what would make their work safe better. And I think that's a good strategy, and it's a good start. For far too long, the risk of violence has simply been seen as part of the work that nurses do, part of the job. The problem is, this acceptance means we don't do everything in our power to minimize the risks, and that's just what we have to do.
Well, violence in the workplace impacts nurses in many ways. I mean, the obvious would be physical injuries sustained during an attack, but the psychological injury is what is also very concerning. Certainly witnessing a violent attack or even experiencing verbal abuse can have long-standing impacts on nurses.
We will not stop until every nurse has improved safety in their work site. So it may take some time, but we will chip away site after site after site until we secure safe workplaces, because it's when you have safe workplaces that the nurses who want to provide safe patient care can provide safe patient care.